Please read the instruction carefully before testing. Tear off sealed inner package and take out the test card. Place the test card flat on a clean platform. During the test card should be placed on the horizontal desktop. The test card should be fixed and do not remove the test card. Once opened, the test card should be used within an hour. Use nasal swab to collect samples. During sampling, the swab head should be completely inserted into the nasal cavity and gently rotated 5 times. After removal, the swab head should be sampled in the other nasal cavity the same way to ensure enough samples are taken. Remove the protective layer of double-sided adhesive. If the protective layer is torn off after adding diluent, it is easy to cause liquid splashing. Insert the sampled swab from the bottom of well B into well A. Add 6 drops of diluent into well A. Please do not drop the diluent into the other well. Rotate the shepherd swab 2 rounds, each direction. Fold the left side over. Gently press the adhesive position to make the 2 sides completely fit and start timing. Wait until the purple line appears. The test results should be read within 15 to 20 minutes. Result interpretation. Positive. 2 dark purple lines appear. The test result is positive. Negative. Only 1 dark purple line appears on top. The test result is negative. Test result is invalid if 1. No top line appears. 2. The top line remains blue. Invalid result indicates incorrect operating procedure or the test card has been deteriorated. Please test again with a new card. Dispose medical waste. After the test, please dispose the test card to medical waste bin.